Dr. Natalie Marks, and welcome back to another Quick Cup of Knowledge. Joining me today is Dr. Mary Ann Vande Lind, founder and consultant for Vande Lind & Associates, and a nationally recognized leader in the field of veterinary communications. Thanks so much for joining us today.
Oh, it's so wonderful to be here, Natalie. Thank you.
Yeah. I'm really excited to talk to you because you are really an expert in the field of communications, and that is something that I don't think we can say comes very naturally to veterinarians, right? And we don't get a lot of training in school. How did you get interested in this, and how did you really elevate yourself in this field?
How did I get so interested? It started really when I was in veterinary school, and I was on Med 1. And the teacher sent us in, and he said, Mary Ann, I want you to go in. There's a donor for the university in exam room 1, and I want you to just talk to her. And it was the most elevated students in that first Med 1 block. So it was at first embarrassing that he just wanted me to go in and talk to her and not be a veterinarian. But I realized after that it was the ability to communicate with this person and talk to her about what her dog was. Then when I went into practice, I had a great mentor, who taught me that if you communicate effectively and there's no surprises at the front desk, that the whole day just flows so much better for the whole hospital staff. So as veterinarians, we're kind of the key link in keeping that communication. So it just went on from there. It's a skill you never master, so it keeps you humble.
That is true. And there's a lot of students that are going to be watching or listening to this thinking, gosh, I wish I had someone like this to help me as I'm going through school, because a lot of schools still today don't offer as much in the field of true exam room communication. I know that's one of your fortes. What advice would you give to students right now that are thinking, I'm sort of introverted and I'm not quite sure that I'm ready to jump right into an exam room? What are some ways they can gain more experience in this area?
Well, I think there's a lot of things you can do with just having casual conversations with people and listening. So some of the skills that they're taught with some of the classes that are out there, like open questions and closed questions and how you actually get input, how you actively listen for feedback, are things that they can practice with. But they can also observe people, and observing other doctors in the exam room and what you like and what you don't like, or observing clients' reactions, I think are really good. But the big thing is I would get some good books. And right now there's a great book out, I think, because it takes us out of veterinary medicine and into a different thing. Alan Alda from MASH, has written a book that says, if I understood you, would my face look like this? And he gives some great examples, because he's actually working with human physicians about the use of empathy and communication, but he gives some great examples of how little tiny things that we think the client understood derails the whole conversation because they didn't hear it. So I'll give you an example for the student. Okay, so I know you've seen people in the exam room, a doctor, and they put the stethoscope to the chest and they start listening, and then they look at the client and they say, did anybody ever tell you that your dog has a heart murmur? And immediately the client is in a whole other world. I mean, their mind's racing. Am I going to lose John Bob? Is this the last? And we're just talking about all this stuff. And they've missed everything that we've done. So that's a small skill, giving people information in small chunks and listening.
And body language assessment, it sounds like.
I think body language assessment is gigantic because it's 70+% of our communication, our tone of voice and our body posture. People only remember 7% of what we say. And with that in mind, if we just relax and make it about the client, it could be so much better.
And I'd like to go there because we were talking about exam room communication itself. And how do you go from being a veterinarian who has ups and downs with client authorizations and compliance in the exam room to one who really knows from the moment they walk in, I'm going to bond this client, I'm going to get buy-in, and they're going to be that loyal client for life. What are some tips that some of our listeners can take back tomorrow and start implementing in the exam room?
I think the first thing that I think is really important is you've got to have a process. You wouldn't go in to do a dog hysterectomy and not ever have practiced. And so what happens is we get these skills, but we have no format to put them in. So I always teach doctors that there's an approach to the exam room, and it's 6 steps. So it's how do you prepare before you go in? You know, how do you actually acknowledge and greet that client when you come in so that you've got the body posture in place? And then how do you assess and diagnose the client and where the pet is? And how big is the gap in the knowledge of understanding that's there? And then how do you make a recommendation that's a benefit to the client that solves the pet's problems, you know, in a timely way? And then if they have concerns, talking about those, and then follow up. Those are the 6 steps. But of those steps, I think the most important is for a new graduate. The average person that comes in has been proven in human literature and has been worked on in animal too, that the average person that comes in, each pet has 5 to 7, things wrong. So like take a new puppy. It could be behavior, it could be feeding, it could be puppy training, it could be vaccinations, it could be that. So before you ever enter the room, you should be able to I do a mind map circle. And out of that circle comes all the things that I think would be of concern for me if this was my pet. If it's an older pet, then I may know that last year it had periodontal disease, it didn't get cleaned, that goes on the list. Last year it had a murmur, it's going to go on the list. And then I'll look and see if any of things are related. Do I need to take anything in the room with me? Each minute that we prepare saves 3 minutes in the room, okay? Then when I go in the room, I'm going to be asking questions. So the first thing I'm always going to do is give my agenda. I see you're here for this, and our technician has told me this. Do you have other concerns today or things you want to share? Because that one question can save the exam room. You can have somebody say, well, I just read about thyroid in the paper, or I just researched this. And so then Dr. Google becomes your friend because they've now told you what they're interested in. And so that little bit of listening combined with the pet and what the pet sees, using their words, that's magic, okay? And then if you make a recommendation, it always comes with a timeline. And it always comes with what they can expect as far as the plan. It's not an estimate, it's a plan. Because if the health of the pet changes, the plan changes.
These are wonderful tips that I wish I had graduating from school.
Me too.
Would have saved me a lot of stress and practice. But I want to kind of circle back a little bit to some of these tips because there are quite a few introverts in the profession.
And so we want to deal just with the introverts.
Let's shift there just for a minute and
Okay.
say, for someone listening who says, yeah, that all sounds great, but I have a really hard time assessing body language and feeling instantly comfortable and really conveying that I'm a warm, empathetic person because I'm relatively shy.
Right.
What advice do you give to people who may have that type of personality trait, or do they approach it a little bit differently?
They can approach it a little bit differently. The big thing is that you don't want to put a barrier between you and the client. So the first thing I would do is I'd talk about open body language, okay? So keeping open body language will at least get the client to entertain. If you walk into the room and you go to the opposite side, if you go to the side where the client is, and you just actually introduce yourself, that takes the pressure off you. You're getting their name and you get the information before you go in. Then that actually gives you a little bit of time to listen. If you want to step back to the counter or the table and start taking notes or typing notes, then you can do that at that point, and that gives you a little time not to have eye contact. So the big thing with introverts is you don't have to always maintain eye contact. You don't have to stare somebody down, but you have to have enough that you feel sincere. And if they feel sincere, your introversion is not really the issue. It's their ability to trust to you. So once a client, and sometimes we talk too much, and the introverts greatly at an advantage in that case. So I think sometimes if you go to their side of the table, give them a chance to tell you their concern, and then when you're looking at the pet, okay, whenever you find an abnormal on the pet, ask the client how they're taking care of it. Because again, that gives you a few minutes to think. If you're an introvert, it takes the pressure off and you find out how they're caring for their pet at home. That helps you identify the gap. And it also gives you a chance to catch up if you're nervous about something. Because I once had a doctor, when I was working with him, that got thrown out of the exam room. And she came out and she was an introvert. She said, the lady doesn't like me. And what was so interesting about it was, I said, well, we're going to just go back in there and we're going to ask. So I went back in, and the lady said, you're just here to butter me up. And I said, no, I'm here because your cat is very ill. And I went over what the doctor found. And if you have a concern with our doctor or the way we're communicating, that's okay. We just want to get your pet some help. How can we help you? And then she was like, Fine. The doctor could have done that too, but she needed to see me do it or have a conversation with somebody. Does that make sense?
Absolutely. And I think we could spend days talking about this, and I hope that we can do more in the future because you've given such really great foundational tips. I think for new grads or for people who have been in practice for almost 20 years that just need to freshen up on how to really, as you said, continue to perfect
Just be there.
This art of communication that's so important to the success in the profession. So thank you for all you do. We really appreciate your expertise, and thanks for joining us.
Thanks for having me and making it so easy.